The Ministry of Health, in conjunction with the British High Commission, recently exported labour to the United Kingdom by flagging off 19 nurses to head over to the UK to practice in the National Health Service. What are your dreams? What do you see yourself go to in your career? Sami Wanga, based in Kakamega County, harbors dreams of one day flying over to the United States of America to practice his nursing career. Hello and welcome to Diaspora Life. My name is Pasil Telewa. In today's episode of Diaspora Life, my co-host Chris Omalwa gets to spend some time with Sami Wanga, a Kenyan nurse based in Kakamega County who shares his dreams of one day practicing nursing in the United States of America. And besides Sami, there is also Joe Githinji, a Kenyan nurse who has been practicing nursing in the United States of America and really gives Chris his perspective on how the nurses are treated back there.
I'm Samuel Wanga. From Kakamega. I'm a registered nurse in Kenya, practicing currently in a county hospital in Kakamega County.
Like many young Kenyans, Sami Wanga has had an enduring dream, and that dream is for him to one day migrate to that big country believed to have endless opportunities and possibilities, where the stripes and stars and the eagle fly, the United States of America. In fact, this burning desire to work and live in America led him to choose a career that he believed would make it easier for him to cross the Atlantic to America. And that career is, of course, nursing.
I trained in Kakamega, Kenya Medical Training College. I practiced all my rotation in Kakamega County Hospital, and currently I'm now a registered nurse in the same hospital where I trained.
When did the idea of trying to go and work in the US start?
When I was in school, I had a dream one day to work. I try and have a clear outline to work abroad. But now I have an aunt who is like a mother to me. Introduced me to a good friend of his in USA. So they have been guiding me through, they have been giving me support material and everything so that I can at least come through that.
So Sami studied hard, passed all his exams and graduated as a nurse. For the last 2 years, Sami has worked hard at a job he loves in a place where he was born and raised. A place now rolling with fond memories but also mixed feelings. But Sami has kept his dream of a better place, a place where his career will not only be fulfilled but also rewarded alive.
In your view, what do you think, what kind of opportunities do you see acquiring in a foreign country that is not here? What are the challenges that nurses face here?
Yeah, in Kenya, I think in Kenya, the challenges are a whole lot, starting from infrastructure, the training quality. We have a problem in training setups. Then I think when in Kenya we have done something, devolution is really affecting the health worker scheme, and most health workers now those challenges are facing those nurses to reach out to go and look for greener pastures so that they can come back home and create a good environment for youngsters who want to grow in this nursing field. Because you see, working as a medic abroad will give you opportunities so that you can help those people who are at home. You know, I have a dream also as a nurse, and the challenges that I'm facing here, they make me work smarter so that I can also go outside there, come back, create institutions so that I can support these young people. Just have a great place for them where they can do quality health care. Because in Kenya, I think where we are going, we don't have that good outline of good health care, and that one is affecting young people like us who have bigger dreams. You know, when you work in, let me say I'm working currently in a referral hospital. The referral setup that I am in, I think it's not a good setup for people who want to practice a good health practices. Let me say professionalism or patient oriented. It is a very big challenge, and I think When one day I make it to my dreams, I'm gonna create an institution so that we can at least help these young people who have dreams to come back to their home counties, home countries, and do bigger stuffs in health.
2 years ago, he started on a journey by signing up with a recruitment agency based in the US. Initially, he didn't have a clear understanding of how long the process will take. He didn't envision the many challenges he'll have to face in trying to migrate to the US, the many examinations and tests he'll have to sit for. Initial setbacks notwithstanding, Sami has kept his eyes on the prize. He soldiers on.
So my idea of going to US started immediately after I completed my training in 2019. So since I've told you, I have an aunt who has been a mentor, has been guiding me through the process, giving me enough materials and support so that at least I can gauge myself to attain my dream.
So in terms of just migrating, of course, like everything else, there are always challenges along the way. What are the kind of challenges that you've experienced?
Yeah. I have had a lot of challenges. More so, the exam is not easy. The exam is not easy, it's tedious. And I'm back here in Kenya, I'm also trying to garner some skills. And mixing the garnering skills in practicing and at the same time reading, it's a bit challenging to me. Two, this is another new setup of health. I have to like shifting from the kind of health practices I'm involving in and going to another health docket with different structure. So I think it is a bit challenging because you find the US type of health system is far different from Kenyan system. So I have to adapt. I have to adapt to, let me say, the mode of studies, let me say the mode of training, and it is a huge challenge.
Sami is right because when COVID-19 pandemic was declared in the early spring of 2020, the US was already in the midst of a worsening nursing shortage. With over 1 million additional nurses needed by 2030, America's healthcare system was bursting at the seams. Burnouts and retirements have steadily outpaced increases in domestic supply. In the midst of all these shortages, foreign educated nurses have been a critical resource for the US healthcare system, providing essential life-saving care and representing a huge percentage of the nursing workforce in some of the largest states in the Union. With American hospitals facing a dire shortage of nurses amidst a slugging pandemic, many are looking abroad for healthcare workers. And this is not only in the US. Europe, Australia, and the Middle East are all facing medical personnel shortages. In the US, in fact, reports indicate that there is an unusually high number of green cards available this year for foreign professionals, including nurses who want to move to the United States, twice as many as just a few years back.
I went to South Africa, I think it was in March. Attempted my exam, but I think when the exam is not hard, according to me. The exam is just okay. It's a stable exam that everyone can do. But when I was traveling, I had problems here and there and hiccups. But I went, attempted, saw some bridges, saw some gaps, and the main gap that I witnessed in that exam, I think at the start I was doing what can I say, student-centered type of studying, and student-centered with a new system. It is a bit hectic.
This is Joe Kidinji. Joe migrated to the US recently as a nurse. Nobody understands how complicated the process of migrating to the US is more than him.
Well, my name is Joe Kidinji. I moved here, as you said, almost a year ago. That is in October 2021. Yeah, I'm a trained registered nurse, and I have been trained for over 15 years. And back home, nursing is not viewed with such importance as it is viewed in this country. So I did not do or did not practice much in nursing back home, and mainly because it does not pay well, the conditions are not as good, and the resources are unavailable. There is a lot that would discourage you from practicing nursing in Kenya. Fast forward that to moving to the United States, and nurses are very well respected, they are very well remunerated, and it's such an important profession in this country. Actually, there is a crisis for nurses. To be more specific, nurses are paid to be employed. And when I got here, that was a shocker to me, that a profession that is not extremely valued in monetary terms back home is extremely valued in a first world country. So that alone was mind-boggling to me.
Observing from abroad, Joe hails the Kenyan government for finally accepting the reality that Kenya has a surplus of medical personnel that will utilize their expertise elsewhere. Late June, Kenya's Health Cabinet Secretary Mutahi Kagwe flagged off 19 Kenyan nurses who had been recruited to work in the United Kingdom. This followed by lateral arguments between Kenya and Britain signed by President Uhuru Kenyatta and UK's Prime Minister Boris Johnson in July last year. Mr. Kagwe disclosed that a rigorous process was undertaken to get the 19 from the final list of 3,329 nurses who applied early last year. When I was in Kenya recently, and one of the things that I noticed, there was recently the Kenya government and the UK government came into some kind of agreement. And I was told that close to over 700 nurses were shifting. They were going to work in the UK.
I watched that and I saw that, and when the president signed that agreement with the UK to create opportunities for nurses to work abroad, and I really commend that, because if we don't have enough opportunities for them to work back home, then it's important that the government facilitate at least the bare minimum, the ability for them to move abroad and to work there. I'm yet to see one such an agreement with the nurses in the US, and rightfully so. It might be even easier in the US because you can deal with different state nursing boards in the US. And what Nas Inc. seeks to do is to identify different US nursing boards and look at what are their requirements. What does it take for them to get foreign nurses working for them? And when we get this information and consolidate this information, we are able to work with our government structures back in Nairobi to advise on this is what is required for the nurses to move here. And if we are able to facilitate that, a discussion at a government level, at an individual level, and at an organization level, happy to be engaged in doing that as well. Nursing profession systems in Kenya do not outrightly provide or are not loud enough. They do not give information enough to nurses to know that whereas there are no opportunities back at home, there is a lot of opportunities outside Kenya. So the lack of information, the lack of knowledge makes them fearful of what would happen if they looked outside Kenya for nurses market. That also coupled with the fact of gory stories we've had of employees taken from Kenya, exported to other countries and being exploited and being tortured, and all those other negative stories have made it very difficult for people to look at opportunities outside Kenya. So I think the fear of unknown and the history of foreign recruitment that we've had back home, especially looking at Saudi Arabia and Middle East countries, yes.
This is precisely why Joe recently hooked up with some other Kenyans living in the US to set up a processing and recruitment center in Westlands, Nairobi.
Nas Inc. is an organization that came about. We are looking at bridging the gap between human resource, specifically nurses, between Kenya and the US. We are looking to empower nurses and take them abroad. We are looking at the student nurses, training them, because we realize there's a gap when it comes to soft skills and nursing. So we want to empower local nurses for both local market and international market. That's why we're here.
So basically, how do you go about doing this?
Currently, we've just finished setting up office. So we are looking at student nurses to come on board, register with us, take up different programs in terms of soft skills, and then we put them out there for the Kenyan market. We are looking at experienced nurses who have over 2 years, where we take them through the English exam and we register them through the international licensing boards so that we can get them a contract with right now we are specifically dealing with the US. So once we take them through the whole process, register them for the NCLEX exams, coach them on how the exam is done, and then they sit for the exams, and then we take it up from there.
Among the things this center is supposed to do is to open up an NCLEX testing center, the first one in East and Central Africa. NCLEX is a specialized examination that any nurse aspiring to work abroad has to sit for. As it is now, Kenyans have to travel either to India or South Africa to sit for this exam.
Having come from a middle class, or traveling from Kenya to South Africa is hectic, because you have to have an interlink of planes from Kenya to Ethiopia to Johannesburg, and you see that is one of the problem. And I have an experience with Kenyan Airlines when I was going to do this exam, kufika JKIA, and I found my ticket is missing. The data is not there, and exam is on Thursday, and now I'm traveling on Wednesday. I took a plane on Wednesday 6, and I'm in South Africa at 5 a.m. And kufika South Africa, South Africa, it is another country to another level, because wananiambia siwezi ingia kwa hoteli hiyo 5, I had to wait outside, and the exam is at 4. Sasa nangoja at the receptionist mpaka kitu 12. I've not showered, I haven't taken anything, and an exam you have to sleep approximately 8 hours. You have to rest, you have to do some few stuff, you have to review notes. So when I reached there, not because that I had not read or I'm stupid, no, but because of the hitch up on some few issues.
I'm a trained nurse, and up to the point when I had an opportunity to come here, I had very little information as to how that process works. And then we see a lot of imbalance where we have a lot of trained, unemployed, or employed with very low remuneration back home in Kenya, and suffering from unemployment. And on the other side of the world, in the US, we have such a high demand for qualified nurses and the need for foreign trained nurses to bridge the gap. So when I got here, I realized that there is an opportunity for our local nurses to better life, better opportunities, better employment as nurses, and to grow their profession. And so just not to be another agency, we looked at how to bridge that gap. And it's really an information gap, information about the access. And that is the gap that Nas Inc. seeks to fill. In a nutshell, what we envision doing is providing all the necessary information that a nurse trained and qualified in Kenya requires to be employed and to work in the United States, for starters, and also to get from the agencies in the United States the requirements they have, the requirements they need for a nurse trained in Kenya to work in the States. And so the nurse in Kenya is well informed before making a decision to move abroad. And the agency in the United States that's seeking to recruit this nurse is well informed of the kind of nurse they are getting from abroad. So we exist to bridge that gap, to make sure the process is smooth, to make sure that there is informed consent and informed decision making, and make it better for the nurses wishing to work abroad.
The irony, however, is that the Philippines, Kenya, and India provide 94% of foreign trained nurses working in the US and Canada. Philippines and India have NCLEX exam centers. Kenyans have to go to South Africa, who are not even players in the market. It will seem that having an NCLEX testing center in Nairobi is urgently needed.
We must say that we have not exploited this opportunity for a long while as Kenyans. Yet also we can confidently say that there are many nurses, there are a number of nurses we know that have migrated to the US and worked through different agencies and are here. But they have not even touched a tip of the demand that is in the US for nurses. Of course, we look at West Africa, and they're more aggressive than we are. and looking at the kind of nurses we produce as Kenyans, and even our ability to communicate and express ourselves as Kenyans in the country, we find it an easier way, or we find the nurses from Kenya having an easier time to work and express themselves in Kenya, no pun intended.
Because of the King's English.
We don't struggle much with the kind of, we are trained in English. In our private hospitals, we communicate mostly with our patients in English, and that is just what we transfer to work here, and just engaging with patients in the US and with your co-workers in the US. You don't struggle as much as I've seen some people from other African countries struggle. So that's a given fact. And so we want to tap more into that, and we want to exploit that opportunity and have many, many nurses from Kenya migrate to the US and get these opportunities. Yeah.
Awesome, Joe.
Thank you very
Thanks
much.
for finding time to speak with us.
Thank you for having me.
Unfortunately, that's all we had for you today. I hope you enjoyed the show and learned something. Join us again next week and every Saturday at 8:30 p.m. Kenyan time on KTN News for more stories of Kenyans living in the diaspora. And if you have a story you'd like to share with us, please write to us through Diaspora Life at standardmedia.co.ke or DM us on our social media platforms at Diaspora_Life or at KTN News KE. You can also follow me at Pasil Telewa on Facebook, Instagram, Twitter, TikTok, and YouTube for more of behind the scenes. Until next time, hope to catch up again with you soon.